The surprising link between DMIT and ADHD. A DMIT, Dermatoglyphics, Multiple Intelligence Test report is a tool that analyzes fingerprints to provide insights into an individual's brain structure and function, learning styles, intelligence, and personality traits. While the DMIT itself is not a diagnostic tool for ADHD, it can offer valuable information that may help identify potential markers of ADHD and guide interventions for improvement. Here's how the DMIT report can potentially be used to support the identification and management of ADHD. 1. Brain lobe analysis. The DMIT report provides insights into the development of different brain lobes, which can give clues about attention, impulse control, and emotional regulation. Prefrontal cortex, attention and impulse control. This part of the brain is crucial for decision-making, impulse control, and attention regulation. If the DMIT report shows underdevelopment or dysfunction in the prefrontal cortex, it may point to issues related to ADHD, such as inattention and impulsivity. Temporal lobe, emotional regulation. The temporal lobe is responsible for processing emotions and auditory information. An imbalance in this area may be related to difficulty in managing emotions, which is common in ADHD. 2. Learning style analysis. Children with ADHD often struggle with attention in traditional learning environments. The learning style section of the DMIT report, which identifies whether a child is a visual, auditory, or kinesthetic learner, can help tailor educational strategies to their strengths. For example, a kinesthetic learner who learns best through movement may benefit from more hands-on activities to help them stay engaged. An auditory learner might need structured instructions with auditory cues to hold their attention. Identifying the dominant learning style can help reduce distractions and increase focus during educational tasks. 3. Multiple intelligences. ADHD often affects executive functioning, such as planning, organizing, and maintaining attention. The DMIT report also highlights an individual's multiple intelligences, for example, logical, mathematical, linguistic, interpersonal, spatial. This can help identify areas where a child with ADHD excels and areas that may need extra support. For example, a child with strong logical mathematical intelligence may benefit from structured problem-solving tasks that engage their strengths. A child with strong interpersonal intelligence may thrive in group activities and benefit from social interactions that help them stay focused. 4. Personality and emotional traits. ADHD is often associated with emotional regulation issues, impulsivity, and difficulty in controlling emotions. The DMIT report's analysis of personality traits can give insights into these tendencies. Children who are more impulsive or have trouble staying calm might show traits of high energy or a quick emotional response in the report. The report can also show tendencies toward sociability or withdrawal, helping counselors understand how the child interacts with others and how to tailor their behavior management strategies. 5. Brain fingerprint analysis. Some DMIT reports include a fingerprint analysis to assess the overall brain activity and functioning patterns. This can show which brain functions, like attention, memory, and processing, are stronger or weaker, which might help identify ADHD symptoms. If the brain's processing speed, memory, or attention areas appear underdeveloped or poorly connected, it might suggest difficulties related to ADHD, such as attention lapses or impulsivity. How a DMIT counselor can use this information for ADHD. 1. Focus on the prefrontal cortex and executive functions. If the report shows underdevelopment in the prefrontal cortex, counselors can suggest specific activities to help improve attention and impulse control. These might include exercises that focus on self-regulation, time management, and problem-solving skills. 2. Learning style adjustments. For children with ADHD, the learning style section can be key in creating a tailored education plan. Teachers and parents can implement strategies that align with the child's preferred learning method, visual, auditory, kinesthetic, helping them stay more focused and engaged in their learning. 3. Strength-based approaches. ADHD children often excel in certain areas such as creativity, interpersonal skills, or logical thinking. By understanding the child's multiple intelligences, parents and teachers can focus on activities that cater to their strengths, helping them build confidence and feel successful in areas they enjoy. 4. Behavioral and emotional regulation. If the DMIT report suggests the child has high emotional sensitivity, the counselor can suggest strategies to help manage emotional outbursts, like mindfulness, relaxation techniques, or structured routines that offer predictability and reduce impulsivity. 5. Personalized interventions. The DMIT report allows for a more personalized approach to supporting a child with ADHD. By understanding the child's unique brain structure, learning preferences, and emotional traits, counselors can recommend specific interventions, such as therapy, medication, or behavioral strategies, designed to work with the child's natural tendencies. Conclusion. While the DMIT report does not diagnose ADHD, it can provide a comprehensive view of the child's brain development, learning style, and personality traits, which can offer valuable insights for managing ADHD. Counselors can use this information to develop tailored strategies that support the child's attention, behavior, and emotional regulation, ultimately helping the child thrive both academically and socially. Thank you for watching the video. If you need more educational videos, please subscribe to the Mind